So this is a small paper on intraop online pachymetry. I've been using this since 2005, so it's not new for me. But we all know that there is possibility of having an online pachymeter in the excimer laser. And it's a direct integration between, it's actually a fiberglass coupling device, which automatically measures the corneal thickness during different steps of laser surgery. So it is a very useful tool, and we'll tell you why. So we did do this 50-patient study in April 23 in myopic and myopic astigmatism. We checked central corneal thickness, compared it with the pentacam as well as the ultrasonic pachymetry, and calibrated all the devices so that it almost comes to the same. We also did the femto bladeless LASIK flap for everyone between 90 to 110 microns, and this was followed by the laser treatment. We took the online pachymetry reading and did a study on that. The biggest advantage here is that when you open the flap, pre-ablation, you can get a display of the online pachymetry, and that actually tells you the flap thickness. So you can have the pre-ablation flap thickness, you have the, before you make the flap, you have the corneal thickness, and once you put the flap back and the flap is closed back, you can remeasure at the same time. So this is all the data that you can gather one by one during each step. So it's an online pachymeter which continuously functions during different steps of LASIK. So here we had a mean spherical equivalent between -4 and -3, a mean stromal depth of ablation between 82 plus or minus 22 microns. We had a flap thickness of 90 to 110 microns, and a residual stromal, our target for residual stromal thickness was 300 microns in all eyes. Of course, the optical zone was between 6 mm to 7 mm, depending on the amount of astigmatism, because we know that higher the astigmatism, larger the optical zone, better the outcome and lesser the regression. So here the conclusion was it has a big advantage. Specific features is diagnosis of the thickness of the flap, which is very, very important. Another thing, it's contact free, so you're not touching anything anywhere. Also, individual ablation depth, dehydration effects on the cornea can be monitored, and improved intraoperative safety and quality of LASIK. So in conclusion, having corneal thickness measured continuously is quite crucial. We have this on the Schwinn platform, no financial interest, to assess different flap thicknesses and accurate measurement and depth of ablation during the treatment. So this does work very, very well in our hands. Thank you.
That was really nice and crisp, actually. I just wanted to know whether you have compared it by doing post-op OCT, and
Yes.
whether it's comparable.
Yeah, so firstly, I've started this in 2005. So that time, we didn't know what to calibrate it with, and you can have different readings, like you know that a pentacam or an anterion or an ultrasound will not. So first thing is to calibrate all the instruments so that they give the same reading. Yes, there are two main advantages. One, I have done now, because then femto came in, and then we had the OCT, which has come in later. So we have compared, and it's extremely accurate. One more thing I didn't say, because it's a paper, it's a legal document in your hand. So if the patient develops ectasia, so this can come out as a printout from your excimer laser that this was your thickness of the flap, this was your pre-ablation thickness, and after the ablation, this was your thickness. So actually, it's a legal document which can protect you in a later date, which is very, very useful. One more thing I presented in the US long time back is called interface river. So when we put the flap back, and if you don't do the sweep, it has 60 microns of fluid in the interface, which we never knew. So unless we don't do that flap back to align the whole flap back, we never knew how much was the amount of fluid lying there. So these are the other advantages. And some of the centers, you know, use the blade for 10 cuts, 12 cuts. And we all know that each blade gets it, each cut gets it by 10 or 12 microns thinner. And that's another big advantage of online pachymetry. Of course, in femto, we all know that they're all consistently the same, plus or 2, 4, 5 microns. But in blade, it's a big safety tool. So I have a pendulum microkeratome. Many people don't have that. You have the Moria, which consistently does. So it's very useful that, yes, your blade is cutting well, and you can continue to use the same blade in the left eye, or you need to change the blade. So I mainly use it more like a safety tool.
So do you think it will be helpful in LASIK extras?
Of course.
PRK extras?
Yeah. So I've done one very odd out of the box is I did a +9, and I did a LASIK extra on a +9, which is off the record. Patients doing extremely well, but it does help, because if the corneas, of course that was a hyperopic LASIK, did well, but if your cornea is a little thin, you can monitor it at the same time, And because I'm doing the LASIK extra in the examer room, so it does work quite well.
Just for curiosity, I want to know that how much of flattening you could get by doing LASIK extra in that case. Just
So
want to know.
you'll be surprised, sir, that +9 is still emetropic, and now it's more than a year, and there is yet no regression.
No, for +9, obviously you will have a steepening of close to 9 diopters.
Yeah.
So,
So he went
with
till about
CXL,
52. I went till 52. As far as the post, normally cutoff is 51K. So this was correcting 51 point something. Now I'm waiting because it's only 6 months, 8 months old. Now the CXL will start flattening it.
Okay.
So the flattening was, and anyway, flattening will help him to maintain it because that will hold on to it. So idea of doing this LASIK extra was that we hold on to what we have done.
Thank you.
Thank you.